Hello, I'm Andy Downton and welcome to the latest podcast from the Staffordshire and Stoke-on-Trent clinical commissioning groups. This week we're talking about diabetes, and joining me to do that is Sarah Orme, Diabetes Service Manager and Diabetes Clinical Lead at the Midlands Partnership NHS Foundation Trust. Hello, Sarah.
Hi, Andy.
Just to begin with, tell us a little bit about you, your role and what it means.
Okay, so I have been working in diabetes in Staffordshire for around 17 years now. Worked my way up from a diabetes specialist nurse, took the role of team leader, and now operationally manage the service across the county. So I came up to Stoke and North Staffordshire in January last year. Operate as the clinical lead as well, so as well as kind of managing the day-to-day work, I also support the team clinically with clinical supervision and education, and obviously out to the other wider healthcare professionals as well, so general practice, our district nursing colleagues, we work closely with the hospitals, so yeah.
It really is a true partnership of all the organisations then, isn't it?
Mm-hmm. Yeah, it is.
Let's just go back to the beginning then, because diabetes is something that we could probably all heard of, but back to basics. What is diabetes? Okay,
so there are two distinct types of diabetes. There are many more, but obviously type 1 and type 2 will come into the forefront mostly. So type 1 diabetes is when the body doesn't make insulin at all, and the only way to treat that is with insulin injections. So historically that's been a disease that happens in children, but as we go through, type 1 diabetes can happen to anyone at any time. Type 2 diabetes occurs, is more of, it can be a hereditary, it can be a lifestyle kind of disease, it can be because of ethnicity, but it's characterised by central obesity more often than not. So that's when the body does produce insulin, but it doesn't produce it in enough quantities or as well as it should. So the body demands a lot of insulin and the pancreas can't keep up with making that demand, and we get something called insulin resistance. So that's where the cells of the body just are resistant to the insulin, and it doesn't work as effectively as we would like it to.
So for people who haven't got a diagnosis, what type of things should they be looking for? What are the signs? What are the symptoms?
Okay, so if your blood sugars are high, I mean, often we pick it up now from just routine blood tests. I guess at this time, we're not getting too many routine blood tests done, with GPs working a little bit differently. But if you were looking for symptoms, you would be more thirsty than usual, you would be quite tired, you would be going to the toilet a lot, potentially getting up in the middle of the night, you might have some blurred vision, potentially you would have thrush both in your mouth and genital thrush as well, urine infections. If you're somebody who's got leg ulcers already or any kind of wounds, they might not be healing as effectively as we'd like them to. So all of those kinds of signs would point to high blood sugars.
Footcare seems to be a really important thing. Why is that?
Okay, so Footcare with diabetes is very important. So when you've had diabetes for quite a long time, the nerves can become damaged by high blood sugar levels, and that can cause us problems with, so potentially you could stand on something, or you might have something in your shoe that you're unaware of, and you wouldn't feel it because the sensation from your nerves is damaged. So that in itself could cause an ulcer, which you might not necessarily notice, and then blood sugars are high, potentially that's not going to heal as well as we will want it to. So obviously checking your feet is really, really important. Every single day, just give them a check over, make sure there's no sores, make sure there's no wounds, and obviously when you can, go to your GP practice and make sure you're getting the monofilament tests and to check that your pulses are present, because that kind of is the surveillance that tells us that the nerves are becoming damaged or the circulation isn't as good as it could be.
At the moment then, obviously we're dealing with the coronavirus pandemic. How is that affecting the work that you're doing and across management of diabetes?
We're just reforming our diabetes service now. So we've had a diabetes service operational throughout COVID-19. In the very early days back in March, we did send some of our staff to support our district nursing colleagues with discharges from hospital and their caseloads. We've tried to really maintain a focus on diabetes in there. So while we've been doing that work, we have reviewed all of the patients on the district nurse caseload that take insulin. So we've really upskilled district nursing. We've given those patients an extra review. During that time as well, we've had some staff remaining in the office, so our phone lines have been open, and we've been really focusing on those emergency kind of experiences, really. So we want to try and prevent people going to hospital. To reduce the burden on secondary care, we've been trying to put measures in place in primary care. So that would be to ensure if people are unwell, they know how to manage their diabetes. If they've got high blood sugars, we're making sure when their blood sugars are coming down so that they're not at any more increased risk of becoming unwell. It might be that they've got low blood sugars, so which again could potentially result in a hospital admission. So we would make sure that their medication is reduced to prevent those low blood sugars, to stop them going into hospital where potentially catching COVID-19 would be a bigger risk. So all of our work has really been around admission avoidance. So we have had some urgent insulin starts, so people that really needed to start insulin because their symptoms were quite severe. So we've managed to do that kind of work virtually. So we're using video consultation to support patients. We're using lots of telemedicine, so we're having lots of telephone calls with them. Where we've needed to, we have absolutely gone out and visited patients in their home, obviously using the right PPE to make sure that they're protected and we're protected as well. One of the big things that we've done and really want to kind of get out there is we've created a website. So that website has got lots and lots of self-help information on it. It's got leaflets that you can print off. It's got information around mental health in COVID, because that it's a really tough time to have diabetes. Diabetes is tough anyway, but then when you can't see your healthcare professional in the way that you normally do, that's even tougher. So there's lots around diabetes burnout on there. We're just trying to get some links on there for healthcare professionals as well, so that we'll have a dedicated healthcare professional area. So that's up and coming, and we've kind of really pushed that during the time that we've been enduring the COVID pandemic.
And what is that website?
So it's www.mpft.nhs.uk/services/diabetes-services-adults.
We'll put a link down in the description as well. We are in the times of coronavirus, as we've said. Is there anything in particular that people who have diabetes should be thinking about? Is there any particular concerns?
The evidence that came out last week from NHS England, and Jonathan Valachi, he was on Breakfast TV. So what came out of his study was that people with diabetes are more likely to die from COVID-19. So the best thing that we can do is prevent you guys getting it. So we obviously, keep your blood sugars well controlled. We are here to support you with that. If you are under our care, please get in touch if you've got problems. So we will be looking to make sure HbA1cs are well controlled. So that would just mean for you guys following your healthy diet. Make sure you're doing some exercise. Make sure you're taking your medication. And the other big risk factor, again, is obesity. So again, all of those things that you would do to control your blood sugars, again, will help control your weight. So yeah, I think if you do become unwell, obviously make sure you're testing your blood sugar more frequently. If you're type 1 diabetic, make sure you're checking your ketones. If you've got any concerns at all, please do get in touch with us. We are open and available to support you. And there is also a national helpline as well. So, in the unlikely event that we're not available, NHS England in conjunction with Diabetes UK have set up a helpline for people that take insulin that is manned by volunteers from the diabetes nursing or healthcare professional community. So that's also available, and we can add you that phone number as well to that link.
We'll add that as well down in the description.
Yeah.
That is important to remember though, isn't it? Through all of this, the NHS is still open.
Yeah, definitely.
Again, going back to the other side of people who haven't had that diagnosis, it's still get in touch with the GP. You might not see them in the same way, but they are still there.
Yeah, and I think, we're working differently. So we're just stepping our services back up from next week. So we're looking at how we do that differently. So we have rag rated our caseload so that we know who are our most at-need patients. And now we are starting to book those in. And obviously we're offering those video consultations where we're using some kinds of technology for type 1 diabetes. We can do that via just something called LibreView, which is a program that allows us to see blood sugars directly from the sensor that somebody is wearing. We can use telephone calls. And then obviously moving forward, it will depend on kind of where the government go when we open up our clinics to face-to-face appointments again.
And so just thinking wider then, If there's one change that people could make that would make a big change to people's lives, what would that be?
Think about the things that you can control and control them, and don't worry about the things that you can't control. Rose Stewart is one of the diabetes champions, and she is doing quite a lot of work around psychological health. She is saying, think about those things that we can control. You can control what you eat, which will improve your diabetes. You can control whether you take your medication or not. You can control your exercise. The things you can't control is COVID-19, because none of us can control that. But you can control how much contact you have with your friends and family. You can make sure that you're socially isolating, so you can reduce your risk. And then the things that you can't control, it's about parking, isn't it?
So Sarah, thanks very much for your time. All those links that we've mentioned during the podcast will be down in the description underneath. Thank you for listening, and we'll see you next time.